Welcome back to Houston Life. In honor of Childhood Cancer Awareness Month, we're spotlighting one of the largest pediatric cancer and hematology centers in the country, located right here in our very own backyard. The heroes at Texas Children's Hospital aim to provide the most advanced care possible for patients. And here with more on their research and approach to safer treatments are Dr. Will Parsons, along with Dr. Shobha Navai. Welcome, doctors. We are so grateful to have you here to chat with us about this tremendous month. I was just saying, it's such a gem to have Texas Children's literally in our backyard. We feel very blessed to be able to call Texas Children's our very own.
Thanks for having us here.
Absolutely. So let's jump right into it. When we're talking about Texas Children's, they are available in all 50 states and more than 56 countries over the past years. You've got lab and clinical researches for the 21st century approach to this treatment. Let's talk a little bit about precision medicine.
Sure. So precision medicine is the idea that we treat each patient and family differently, so we understand each patient's cancer and why it's formed, and then try to give treatments that'll be the safest and most effective for that patient.
And I'm sure being something more than just a number, a patient number for parents and families, goes miles and miles and miles.
Right. It's definitely an idea that people can understand and be attracted to, that each child is different, each cancer is different, and we have to figure out the best way to treat them based upon their genetics and biology and what drugs we have available.
Of course. Now, you mentioned you individualize these treatments for the patients. How exactly do you go about doing that?
Well, we've had to develop a number of advanced genetic tests and things that we use in the laboratory so that we can analyze each patient's tumor as well as their blood and understand why the cancer developed. And then we can use that information to pick specific drugs that have been targeted at those changes in the cancers.
All right, so Dr. Navai, let's talk about the cell therapy program a little bit. It is at Texas Children's Hospital. It uses patients' own immune cells to help treat their cancer. Can you explain that a little bit more?
Sure, yeah. So immunotherapy is a type of treatment where we basically in some way try to turn the patient's immune system against their cancer to fight it. So one of the types of immunotherapy is called cellular therapy, and in that case, what we do is we actually take blood cells, white blood cells, which are immune cells from the patient's own blood. We take them to our specialized laboratory and we genetically engineer them to retrain them to fight their cancer. And then we give them back to them and hopefully see what happens.
Now, I'm listening here for all of this information, and it sounds overwhelming, but it also sounds so fabulous. And the technology that you have to do these things is quite amazing.
Yes, we're very fortunate to be in the Texas Medical Center and to have world-class researchers, I think both from a genetic standpoint and from a cellular therapy or cellular immunotherapy standpoint. We have world-class facilities and a lot of really great scientists working on children's cancer.
Oh, absolutely. It takes a team. It takes an entire workforce. Now, a little bit more on immunotherapy. How does it actually work for the patients again?
So when we engineer their white blood cells or their immune cells to retrain it to fight some target on their cancer, we basically infuse it back into them, usually through an IV. And then what happens is once it enters the blood, it goes all around the body, and signals from the body help those cells to expand and multiply, similar to if you were responding to an infection. And then those cells can kind of home into the area where their tumor is and try to kill the tumor cells.
It really is fantastic. Dr. Parsons, I know we talk about 21st century technology, and I know that this is evolving daily. At Texas Children's, do you guys kind of go with these clinical trials and test new things on a daily basis?
Right. So we try and do the best of both worlds. So provide state-of-the-art care using all the new advances and techniques and what we've learned from previous clinical trials, but also, especially for our patients with the hardest to treat cancers, be taking advantage of these new therapies and clinical trials for them as well.
Now, with people with young kids, is there any kind of a way to be on the lookout or kind of prepare or stay away from doing these cancer-like things? Is there something that parents can do as a way to kind of get their children on the healthier side to kind of stay away from coming to see you guys?
Well, we're very fortunate that childhood cancer is actually very rare, and in most circumstances outside of some genetic syndromes, there's no reason that we know of why patients develop their cancer or things that we can do to prevent, like in adults who can avoid smoking or those kind of things. So the best thing that you can do is just take your child to their regular checkups every year, and your pediatrician knows what to look out for, and hopefully you'll never need our services.
Absolutely.
But we have a lot of great pediatricians in the community.
Well, thank you so much for the info, Dr. Parsons. Dr. Navai, thank you again. We appreciate it.
Thank you.
All right, for more information, visit texaschildrens.org/cancer or call 1-800-226-2379.